and we are planning to reopen and see you all in 10 days or so. So hopefully that will be the case, and I just want to remind you all that we are taking the proper precautions in terms of social distancing. Lobby is plenty big, 6 feet apart, a lot of hand sanitizer. We'll wear masks if we need to. We will initially take your temperature, as we will take all of our team's temperature, just to rule out anyone who might be obviously ill. But otherwise, the doors will be propped open. You won't have to touch anything. We've got contactless, Apple payments or whatever it is. But so we'll have more to come. And I'll just, at the onset of this topic, which we're going to talk about hyperhidrosis or excessive sweating, and Karen Whitney is going to guide us through that. There is a Botox promotion. The reason why that's significant for this particular topic is because there's a promotion. Maybe Karen can talk about it. But for hyperhidrosis, and Botox is one of the solutions, as you're going to learn about, it might be a time to consider that. And anyway, all right, with that, I am going to turn it over to Karen Lynch and Karen Whitney to take you through what is hyperhidrosis.
All right. Well, summer's coming along. We're going to be here pretty soon, and that's when sweating really becomes a big deal, and I know it affects a lot of people's lives. So we treat patients with something called hyperhidrosis, and can you explain, Karen, what that means?
I definitely can. So hyperhidrosis refers to excessive sweating, and that's a rather loosely defined criteria. What's excessive sweating for you versus someone else? But in general, excessive sweating is when it interferes with your professional or work life, your social life. It causes you stress, it causes anxiety, and this might be hands, it might be feet, it might be underarms. We also can address some other areas I'll get to, but basically it's excessive sweating that causes you discomfort and a problem in somewhere on your body.
Okay, the other thing is, I know it's a really big deal with sweating too much, but why is that important?
Yeah, so the thing about hyperhidrosis, it's very interesting. One study showed that anywhere from 15 million, another study up to 30 million people deal with what they consider excessive sweating. So it's really big numbers of population. And the depression rate among people with hyperhidrosis is greater. Job dissatisfaction and feeling like they're limited in their professional or work abilities is as high as 80%. So aside from the fact that physically it doesn't feel good to have sweaty hands, to have your feet slip around so much your shoes don't feel right, to have sweat dripping down the side of your chest, even when you're not even apparently stressed or under any tension, is really debilitating. When we talk to patients, we hear that they take 2 and 3 outfits to work every day in order to change before an important meeting. They're trying to wear clothes with pockets and keep absorbent pads in the pockets so they can dry off their hands. If you would never go out after work wearing the same clothes, you have to change multiple times. So clearly it's very expensive, it's very time consuming. Dry cleaning, dealing with replacement clothing, it really takes a big toll on your psyche, your emotion, as well as your physical comfort. And that's why we find that these treatments really can be life-changing for patients.
Yeah, and I just want to emphasize that. I think that, most of the things that we do have a quality of life associated with them. And there are a few procedures that we perform that you may not think about, like treating excessive sweat. But these treatments, and what I guess what Karen is saying is, we see many young people, we see people of all ages, but often many young people who've suffered with this for a long time, they won't go out socially. They will really think about certain events that are important to them, and they often may not even show up for those. So this is something that, when treated, changes people's lives. And there's a great impact on the dilemma that these people have. Besides the outfits, always wearing black and always having something to cover up and always trying to plan accordingly and all the things that are associated with it. Rhinoplasty, otoplasty, also pinning ears back, we don't really pin them back. But those also can be associated with a huge psychological benefit. And so we thought it was important really to discuss it. I confused yesterday when I was talking about it. I saw a 20-year-old yesterday for hyperhidrosis, and her cousin has been treated for hyperhidrosis as well with Botox, and Karen will talk about the treatments. And then, so when this started, clinical hyperhidrosis, I don't know, Karen, what you said, 1%. It's a large number of the population that suffers some really excessive sweating to the point where it's really debilitating. Then there's this area where patients might sweat, as you were talking about, Karen. Maybe they're in a cold environment and they're sweating, and maybe it's a dry cleaning issue, maybe it's an odor issue, maybe they just don't like to sweat, where we can treat those patients as well. And so there are two main modalities, and Karen's going to walk you through those in terms of how they work and which one might be best for you.
Yeah, thank you. So if you are this person or you have normal sweating issues, you've probably examined natural treatments like vinegar and baking soda. You've used every deodorant in the drugstore. You've gone to your primary care and maybe gotten a prescription deodorant. You're still struggling with this issue. So the easiest treatment is with Botox Cosmetic. So Botox is a drug that blocks acetylcholine. And acetylcholine is one of the precursors to excessive sweating. So we can literally treat you virtually anywhere for excessive sweating with a series of small Botox injections. I treat hands, feet can be treated, upper lip, bridge of the nose, the hairline, and of course the underarms. And when we're treating the underarm area, we're really focusing the injections on the area where you have hair growth, because the sweat glands and the hair follicles tend to reside in the same location. And it's a series of very quick, tiny injections. It's a little sticky, stingy, but it takes about 5 minutes. And the effect of the Botox will kick in anywhere from days to 10 to 14 days. You'll have the full effect. And the result is that your sweating is incredibly diminished. The dosing will depend on the size of your armpit and the amount of result you want. In other words, we can treat you lightly and it'll rein in excessive sweating. We can treat you a little more densely with more units and virtually stop the sweating. It's life-changing. The advantages of Botox are that it's such a quick, easy treatment. There's no recovery time or downtime. You wait about a week for the full results to kick in, and it's going to last anywhere from 6 to 9 months. So you really can get through the summer months if it's heat, if heat is causing some of your stress. I have some patients that feel like at 9-month intervals, things come back enough, they're ready to be retreated. When we're treating hands, you and I would talk about, is most of the sweating bothersome more in your fingertips or on the palm of your hand or both? And so we're locating the location of those injections based on your symptoms and your concerns. So Botox is a marvelous, quick, easy treatment. And if you're thinking about dealing with this issue, our $9.99 a unit Botox is really a great opportunity for you. The dosing could be anywhere from 25 units per armpit up to 50 units per armpit. And again, that depends on the size, the severity, and if we're trying to reduce versus eliminate your sweating. Same for hands. We could use 25 units per hand. I've even split 25 units between someone's hands, and it gave her enough improvement that she felt so much more comfortable, especially in her professional environment. So Botox is temporary. We do have a permanent solution to underarm sweating, and it's called miraDry. And miraDry is truly revolutionary. It's based on the fact that microwave type energy is absorbed by density. So the handheld device, which is a one-time interchangeable attachment, is placed under the armpit, and it's treating sections about the size of your fingernail, and it's delivering energy that kills the sweat glands. And so it can take 1 or 2 treatments, and this is a permanent result. So miraDry is really, truly life-changing. And as Dr. Mendelsohn mentioned, someone's cousin had been treated for with Botox. We find that there's a familial component. I've treated mothers and daughters. I've treated aunts and then nieces. Sometimes the wife is purchasing this treatment for her husband because it's so distressful. So it's a really fantastic treatment. The way it works, you would come in, you have shaved your armpit. I'm going to cleanse it thoroughly, and I'm going to use a series of tiny little sticks to numb the underarm area. Because of the intensity of the energy, we have to use numbing, or you wouldn't be able to tolerate the treatment. The numbing doesn't take long. It is uncomfortable, but it goes very quickly, and then you're in great shape. Once the underarm is numb, a topical grid, a little temporary tattoo, is applied to the underarm. And that's because studies have been done to see, based on the size of your underarm, where is the greatest concentration of sweat glands, how much energy should be applied, and exactly indicating where I place the treatment head. Like I said, the treatment head itself is about the size of my thumbnail. So following the treatment grid, I put the treatment head on, press the button. There's a gentle suction, which you don't feel because you're numb. The skin and tissue is pre-cooled through the treatment head. Then the energy is delivered, and then it's post-cooled. And the reason for the pre and post-cooling is to protect the skin and surrounding tissues against unwanted damage. So the energy is directed towards the dense sweat gland. It takes anywhere from 60 to 90 minutes for complete treatment of both arms. We, of course, do them both at one time. We do apply ice immediately after and recommend that you use icing at home, really off and on every 20 minutes is what I tell patients, because we're trying to counteract the expected inflammatory reaction. The miraDry device has just killed your sweat glands, and in response, your body's going to create swelling. And so that relates to some lumpiness and some tenderness of the underarm area. And the more you ice during that first 24 to 48 hours, the less reaction you're going to have. You can take Aleve or Advil as well. Sometimes we order an oral steroid to keep things quieted down. You also avoid physical activity like swimming or playing basketball. You're up and about doing normal things, just allowing time to ice. Then what you'll notice is that your sweating stops immediately, which feels really miraculous to people. And the reason the sweating stops is that the swelling blocks the sweat gland and prevents any produced sweat from being released, at the same time that these sweat glands are responding to the injury and gradually dying. So I tell patients expect some lumpy tenderness for 1 to 2 weeks, and occasionally we see it lasting longer. We do keep track of you and check in with you to make sure you're doing okay. And gradually, with the passage of weeks and even months, those sweat glands that weren't completely killed, that were damaged but not killed, can recover. And if you have enough glands recover, you might choose to come back for a second treatment. And if so, that's always done after all swelling and tenderness is gone and things are back to normal. The second treatment is exactly like the first. And I tell patients, most of our patients have a severe problem. They really sweat a lot. They're dripping down the sides of their chest a good part of the day. Those patients typically are going to need 2 treatments. If you treat someone who's just more bothered by kind of normal to heavier sweating, maybe the odor's an issue, maybe they don't like wearing antiperspirants or deodorants, those patients will probably get very great results with 1 treatment. But it's a marvelous treatment. It truly is life-changing. It's something I really, really appreciate that we offer to our patients.
That was excellent. I almost dozed off with those beautiful wind chimes in the back. So I was like,
that's what happens when you're at home, right?
I like that. Hang out there. Anyway, let's see. So Karen, a couple common questions are, sweat glands, especially with miraDry, so they're gone. Joe, so what happens? Do we need them?
You do not need them. Of course, everyone knows that sweating, perspiration is a way that our body cools itself. We have sweat glands around our body, everywhere. Less than 10% are concentrated in the underarm area. So when we get rid of those, you do not have any negative effect of losing your body's ability to cool itself. So they are not necessary.
Okay. Just going back to the Botox for a moment, for people who choose that, how long does the Botox last for when you're treating hyperhidrosis?
It really does last 6 to 9 months for patients.
Yeah, and so the reason why I asked that question is because people who have Botox for upper facial lines or other areas, right? Allergan, the manufacturer, will tell you 3 months. We know it's probably 3.5, 4.5 months. Some people go 6. It does seem to clinically last a bit longer for things like hyperhidrosis and even migraine headaches as well. But I just wanted to point that out. So it's not as frequent for some of these other things. Karen, did you have some other questions?
Well, I just have one other question, Karen. Do you see anything new coming in the future for hyperhidrosis?
Well, the miraDry manufacturers have been working on a treatment for the hands and feet for quite a long time. The heat delivered, I think, causes some challenges with not damaging the other tissues in the area. So patients ask about that. My hand sweaters really ask about that. And I know they're working on it, but it's not there yet.
You know, just going back to the hands that you were talking about, I know for a number of years I treated, well, today I don't know if we'll be shaking hands as much, but one of the Fifth Third bankers used to come in, and even though he sweat in both hands, we treated primarily his dominant hand, or at least the hand that he was shaking with. And to your point, Karen, with summer coming, a lot of ladies with their soles, they might slide out of their shoes. Or, they might have difficulty walking, especially with the heat and humidity. So a lot of different body parts. I do see also, we've seen patients who, I guess they have a secondary effect. They sweat their scalp, their forehead and their scalp. So when they're treated for their lines and wrinkles, they also have a secondary benefit there that they're not sweating there as well. So, so anyway, the axillary hyperhidrosis, I think, is obviously for miraDry. That's the only area that we treat, and it really is a life-changing treatment for patients. So, anything else you guys would like to add?
Only that sometimes patients will come and we have the conversation. They've heard about miraDry, but they haven't met us and don't know if they really want to take that leap. It is more expensive, of course. So sometimes patients will do a Botox treatment to their underarms, get them through their decision-making process, get through the summer when they want to be physically active and don't want to have any swelling or tenderness in their armpit, and then go on to do the miraDry at a later date. And that's a great approach where you're meeting us, you're meeting our team, you're seeing the facility, hearing firsthand, face-to-face, what's miraDry about, experiencing the incredible relief with Botox, and then deciding to do miraDry.
Yeah, I think there's a lot of skepticism with many things, and you'll see younger people come in, younger 20s or teens or early 20s, and with their parents sometimes. And I think that I think if you're not one that experiences the problems associated with hyperhidrosis, but parents usually are in tune with it because they know what their kids are doing, at least to a certain degree. I think that this is something for parents to recognize. This is probably one of the best things you could do for your child. It really is a life-changing event. I know I've said that, but I was surprised. I'm like sweating. What's the big deal? I don't have that problem personally, but when we treat patients, it really is a game changer for them. So, okay. Well, good. Well, thank you very much. And we will be back tomorrow. There will be more updates as we get opened up here, hopefully May 2nd, May 1st, May 2nd. We look forward to seeing you all, and thank you again. Have a great day.
Thank you.
Bye.